Good afternoon, and thank you for joining the RLS Foundation's special RLS Awareness Month webinar titled How to Educate Your Healthcare Provider. My name is Adriana Colucci, and I'm the Administrative Assistant at the RLS Foundation. The RLS Foundation has been using a new webinar platform, Zoom Webinars, for this and all future webinar events. To ensure seamless webinar access, confirm that your Zoom app is up to date with the current software. If you need help accessing the live webinar on your computer, call the phone number listed on your registration confirmation email for assistance. If you have any other questions, please email clara@rls.org. Before we begin, please be aware that all attendees will remain on mute during this hour. We thank you for the questions submitted with your registration. The presenter will answer as many questions as time allows following the presentation. After the webinar, the recording will be available in our website's member portal section on the next business day. If you are not a Foundation member and would like to view this and other recorded webinars, we invite you to become a member today by going to www.rls.org. As always, individuals suspecting they may have RLS should consult a qualified healthcare provider. The information offered in this webinar is for informational purposes and should not be considered as a substitute for the advice of a healthcare provider. Our speaker today is the Executive Director of the RLS Foundation, Karla Dzienkowski. In January 2014, Karla accepted the Executive Director position. Since then, she has made a huge impact on the organization. Karla first learned about RLS in her dual roles as a mother and a registered nurse when her daughter, then 11 and a half years old, began to experience symptoms that doctors could not explain. Karla crossed the country looking for answers before finally finding a knowledgeable provider, and shortly after, the RLS Foundation. Eager for answers, Karla joined the Foundation's Board of Directors in 2003 and served through 2009. As a board member, she encouraged pediatric RLS research programs to increase awareness and education of RLS in the medical and school communities. Karla believes that much work has yet to be done in disseminating information about RLS to the public and the medical community, and that much more research into its cause and treatment is needed. Karla drives the mission of the Foundation with her leadership, and she is passionate about promoting research for better treatments and a cure. Thank you for sharing your time with us today, and I invite you to begin your presentation.
Well, thank you for that wonderful introduction, Adriana, and welcome everyone. Today, we're going to talk about how to educate your healthcare provider. So our agenda today is we're going to look at four things. We're going to look at finding the right HCP or healthcare provider, developing a plan of action, how to establish an effective communication strategy, and how you're going to decide if you're going to continue or switch your healthcare provider. So let's look at this, how you identify a good healthcare provider. So there's some frequent questions that we receive about HCPs at the Foundation. I wanted to let you know we hear about what type of doctor is able to treat RLS. Am I seeing the right provider? Are there any experts in my area? Why doesn't my provider listen to me? What can I do to educate my HCP? And what is the best document to share with my doctor? So here's a quick poll question. Healthcare professionals in which medical specialties treat RLS? Neurology, primary care, sleep medicine, pulmonary medicine, APRNs, PAs, some of the above, all of the above. Right? If you answered all of the above, you're correct. So I want you to pay close attention to primary care because we're going to talk about doctors who, when we say primary care, we're talking about internal medicine, family practitioners, and even DOs. So we see a lot of PAs and NPs entering into the field and are eager to learn about RLS, as well as sleep med, neurology, and pulmonology. Also, you've got our RLS quality care centers where you can receive expert care from certified RLS providers. And we also have a healthcare provider directory on our website. I want you to know that our staff works really hard at the American Academy of Sleep Medicine meeting called SLEEP. Over 5,000 sleep professionals attend this meeting a year, and we are constantly looking for new providers from all over US and in Canada and abroad, if we can find people who are willing to be on this list. We know that they're highly motivated because they're at the sleep meeting and that they're interested in treating RLS. So let's talk about developing a plan of action. First of all, most people, we go to first resource, friends and family. You're looking for recommendations. So the second one is you want to seek providers covered on your insurance plan. Ask if RLS is their specialty and how many patients are they treating, because that'll give you an idea. Are they seeing a lot per year or just a few? I'd check their credentials on Doximity, and then I would check online reviews. You want to look at Vitals, Health Grades, WebMD, etc. And you want to read and interpret the positive and negative reviews. So let's look at a sample HCP online credentials. So we have Dr. A and Dr. B. So Dr. A is a sleep medicine specialist in Middle America and practices at Hospital X. They're board certified in neurology and sleep medicine with special qualifications in child neurology and accepts multiple insurance plans. Great. Conditions treated: epilepsy, sleep disorders, keyword there. Specialties: sleep medicine, another keyword. And they've got a great education, U of Chicago. Dr. B is in neurology, same specialist, Middle America, over 20 years of experience. Hospital affiliations, good. Accepts multiple insurance, terrific. Conditions treated: so you have Parkinson's disease, epilepsy, headaches, MS, and Huntington's disease. So they specialize in epilepsy and headache. And they went to NYU, couldn't ask for more. But you see the difference between the two. There's some key wording here: sleep disorders, sleep medicine, child neurology. So those are things that you're looking for if you're trying to identify a provider who specializes in RLS. So we're going to look at some of the ratings that you'll see online. So we did apples to apples, 100 ratings each. So Dr. A explains conditions and treatments, takes time to answer questions, provides follow-up as needed. Their staff is friendly and helpful, and it's easy to schedule an appointment, and the office is clean and tidy, because you want to make sure that that is that way too. You want to make sure you're going to an office that is well cared for. And then Dr. B, the patient perspective was they felt rushed. They didn't trust the provider's decisions, didn't explain conditions well, didn't listen or answer questions, difficult to schedule an appointment, and staff wasn't friendly, and they had long wait times. So these are like polar opposites, but you're going to see a little bit of mix of these different comments online. So you're going to have to weed through these things and kind of look for patterns, and if you're seeing it consistently or not, or if you're going to have a one-off. So keywords in online reviews. So positive reviews, you're looking at listens, answer questions, you feel validated, you're not rushed, helpful, courteous, kind. Overall, it's a good experience. Negative is not enough time, didn't fill a prescription, and didn't listen. I'm going to stop here and talk about didn't fill a prescription, because that's a 50-50 comment there. Usually when you don't get a prescription filled, it's because the patient didn't do something that they were supposed to do, whether it was a follow-up visit, an annual visit, a lab test, something didn't get done. That's a clue. You need to check into the office and see what needs to happen, and even a canceled appointment. And you've already worn out your free your additional refill to carry you over to the next visit. So there's something there behind that one. And so you don't want to, if you continually see staff's rude, that they weren't acknowledged, the wrong appointment time and date was booked, overall you had a difficulty with that office. So now you've kind of whittled it down. We get a drink here. And you found a doctor that you like. So you want to call and confirm that they treat RLS, and then book a new patient appointment. Realize there's a little bit of a doctor's shortage. People retired post-COVID, so it may take a few months to get in. Be prepared for that. Quality care centers, new patient appointments will take several months to book out, because that's each doctor's office and each doctor has their own appointment template. and you have to fit into that slot along with follow-ups, annual visits, emergency work-in slots. So you want to give yourself a lot of runway if you think you want to go to a quality care center. So you want to take the earliest available appointment that works for you, and then I would ask to be put on a wait list. So if there are any cancellations, you can be called and decide if that a time and date will work for you. Now the next step is that you want to educate yourself before you can educate your HCP. Become an informed and knowledgeable consumer. Determine which resources will provide your HCP with the most appropriate information for your current situation. So if you're having issues with iron, augmentation, things like that, you want to prepare your materials for that. So online resources, how to educate yourself. So I'm going to walk through some of the foundation resources. So first, you want to sign up for eFriends. It's a free monthly e-newsletter. Find out what's hot off the press in the world of RLS. You want to attend our monthly webinar series like you're doing today. Watch past webinars on demand. They're archived in the member portal, and you can watch them any time of the day or night. Read the foundation blog at bb.rls.org and follow us on social media. Second, we have a ton of print resources, and all of these resources are reviewed by committees on the Foundation's Scientific and Medical Advisory Board to make sure they're scientifically valid before we print them and put them out in the public realm. So you have a medical bulletin, a causes, diagnosis, and treatment brochure, which is just a quick snapshot of what RLS is, how it's managed and treated. Teen guides. We also have a number of handouts, which are just one-pagers with citations that tell you about a specific condition you might be having, like augmentation or medication question, iron, depression, triggers, coping, surgery. These things are very helpful to you and will help you in your journey. Also, we have Nightwalkers. So since 1989, Nightwalkers has been educating the RLS community through our acclaimed quarterly newsletter. So we have really three sections we'd like to point out. We have In the News, which are journal articles that are reviewed and broken down by Dr. Dzienkowski. It's a really great way to learn about which articles are hot off the press and what questions are being answered and what questions are still outlying. And then Ask the Doctors. Those are questions submitted by you, the members of our RLS community, who would like the experts to fill those. And then Bedtime Stories. Those are tips and shared experience from fellow RLSers about things that have worked for them, haven't worked for them, all kinds of different experiences, but it really adds to the magazine. And then I want you to take out your camera, and everyone who has RLS should have these two open access peer-reviewed articles. The first is the 2021 RLS Consensus Treatment Guidelines published in Mayo Clinic Proceedings. And that, thank you RLS Foundation members, because of your membership, we are able to have that article made as an open access journal. And the second one is the 2018 Iron Treatment of RLS in Sleep Medicine. So that tells you how to manage RLS with iron treatment if you are iron deficient. So I'll pause a minute and then I'll move on. And then I want to talk about other accessible online resources. So I'd probably, if I were you, I would take a picture of this page as well. Is that the foundation has a 12-part RLS medical MD educational series. So that's a series for physicians, PAs, and NPs, so they can learn how to treat and manage RLS. You can also go on PubMed and you can read the abstracts for free. The open access articles you can download, print out, and use for yourself, or you can pay a fee to access the article, and that price varies. Google Scholar, WorldCat, and library databases are other resources online. Let me go. And then you want to educate your HCP, sorry. So you create an RLS information packet that addresses your specific needs, so that you might want to include the medical bulletin, a diary tracker, so you can have a look back over the last 2 weeks or so of how your RLS symptoms are going, what are you noticing, any patterns, things like that. Two peer-reviewed open access journals I just pointed out, an iron handout, augmentation handout, and a link to the webinar series. And coming soon is RLS Curbside. This is a project by Dr. John Winkelman, where doctors can talk peer-to-peer to an RLS expert to help them in the care and management of an RLS patient. So we're still waiting on the rollout. They've just done the beta and they're kind of shaking out all the kinks. And once that's ready to go, we will be sure to let you know. And then you want to prepare for your appointment. You want to make the most of your office visit while respecting their time. So you know the answers to these questions before you go. What is their background and expertise? What is it that you want them to learn? And what content and information will you provide? I always ask this question to myself: what am I taking to this appointment? So you need your insurance card, ID, license, completed office paperwork, results from recent labs, any medical records. With COVID, there are staffing shortages, and doctors are actually preferring that you walk in with your medical record versus having them sent to the office, because again, with staff shortages, things don't move so fast through the system, and they want to make sure they have your records for your visit. You want to have your RLS education packet and a list of questions. And you also want to have a list of your past medications with dates and reason why you discontinued them, list of all current medications, any over-the-counter medications that you're taking, vitamin supplements, and your completed symptoms diary. So now we're going to pivot and look at 3 common RLS appointment types. You can have any in the middle or something like it, but I just figured I'd pick out 3. Okay, you're meeting with an RLS expert. This is nirvana. You're batting 1,000. So you have an HCP who's dedicated their career and their life to managing RLS. They research about RLS. They live and breathe it. They probably are practicing at an RLS quality care center. They have extensive clinical experience in managing all levels of RLS, probably an author on the 2021 consensus guidelines paper, and they know how to tailor a treatment plan to manage your RLS. They're an active listener, understand your concerns. They ask a million questions. You feel like you're meeting with a detective, but these folks really they want to drill it down so that they understand what's going on with you, because their wheels are spinning and they're figuring out how they're going to manage your RLS. You leave feeling validated, hopeful. You have a treatment plan. You got your follow-up scheduled, ready to go. So what do you need to do? You need to read and learn all you can about RLS, have your list of questions ready. In fact, I'd even put them into the notes app on my phone, so if I forget one in there, I can pull up that list and reference it. And then the second type is an HCP with some RLS experience. So RLS is one of the diseases that they treat frequently, but it's not a primary practice focus. They may be listed in our directory, and they can effectively manage mild, moderate forms of RLS. They may have less experience in managing severe and complex cases. They may or may not be aware of the new treatment guidelines, but they're willing to learn from patients and accept a packet of information. Your appointment flow looks like they listen, they ask questions, willing to modify your treatment plan. They want follow-ups, appointments. Overall management is effective until RLS is severe. They're willing to learn. You can work with these folks. So they're a good candidate for RLS Curbside, but also I would say the Foundation's Physician Ed series. They could do it on their own time. We've had over 1,500 doctors listen to this series online, where you're charting or you're in the office doing some paperwork. They've told us they've listened in and what a good series it is. So you leave feeling validated, understood, you got a treatment plan and working docs. So you want to bring your packet of information, your list of questions. So the third one is an HCP that may treat RLS. So RLS is not one of the diseases treated often in their practice, and they may share this with you. They have limited experience in managing patients with all levels of RLS, and they may or may not be up to date on treatment guidelines. They may be receptive to patients sharing information with them or not. So your appointment flow kind of looks like may or may not leave feeling validated or understood. Questions remain regarding your treatment plan. So what's your prep? So you need to bring your packet of information and your list of questions. Be prepared to take on the role of teacher. So you want to make sure you tell them about the Foundation's Physician Webinar Series and RLS Curbside so that they know they've got resources to help them to manage your care, and it might make them someday become one of those, the first kind of doctor that we talked about. So one of the clues to working with your provider is to have effective communication strategies. So what makes you a great educator? You want to communicate effectively, actively listen, know your audience's level of expertise, which you've researched, come prepared, respect their time, don't dominate the conversation, and remember, you want them to work with you as a team. So 4 education steps. So we know their level of expertise. What do you want them to learn from you? So you want to tailor your needs, like we've talked about, basics of RLS, iron, treatment guidelines, augmentation, anything that's going on with your RLS, you want to talk to them about it. Remember, you're going to bring your tailored packet of information, and remember to put a checklist in your notes app or handwrite it, whatever works for you, with headings and bullet points to help keep you focused. Because sometimes you can, appointments, you can get sidetracked, something, another topic comes up. So that'll help you come back to how you wanted to focus this meeting. And then how will you present it? Simple, clear communication, and explain symptoms in your own words. Don't use medical terms unless you're in the field, because it will inadvertently come out off. I would pause for questions and responses. And an easy way to start this is, Dr. X, I thought you'd find this information interesting, or here's this great new article on such and such. I made a copy for you, and just kind of see where it goes. If they ask you some questions, then you've got a runway to give some answers. Keep it concise and to the point, and you'll start building that relationship. So things that you want to avoid is being unprepared, a disrespectful attitude. So you always want to treat the healthcare provider with respect, and you also want to do that to their staff. There's nothing that travels faster in an office than someone who's been rude to a staff member. Remember, they're doing their best to help you that day too, and you want to treat people the way that you want to be treated. So medical knowledge, you have to respect their knowledge and share your thoughts and concerns, and you're going to build on what they know so that you can have a starting point. Medication overload. We never know what's going on in their day at the office. Sometimes they have time to take a little bit longer to visit with you, or short. You got to pace it. You got to kind of fill those nonverbal cues and what you're going to be, how much you can get in and what you can do for that visit. Withholding information regarding your medical history, that is a no-no. The more they know about your past RLS experience, the better they can develop an effective treatment plan. And that goes for your whole medical and prescription history. You can't withhold information. They're electronic medical records, and that it'll be disclosed. It's better that you tell them than them having to find out. Quick drink here. And then demanding specific treatments. All doctors, ANPs, APRNs will conduct a thorough exam and determine a diagnosis based on their clinical experience. The medical exam may cover an underlying medical condition that may not be apparent to you. So they have to walk through this whole exam to kind of figure things out, and then they'll start questioning and asking, and then that's your opportunity to enter in some teaching. Incomplete medical follow-up. Keep all of your appointments, tests, procedures, anything that they've asked you to do to roll out other conditions. And blaming, accusing, argumentative attitude, you want to go in with a positive attitude and treat everyone that you want to be treated so that you can build that trusting relationship. So now is the time. Do you continue with your current healthcare provider or switch? So can I work with them? Am I being validated and heard? Has my HCP been open to the materials I've been providing them? Have changes been made to my treatment plan? Are they receptive to information or not? Do we have a good working relationship? Do I feel like I want to continue working with them? So what part of this is a relationship is a two-way street. So there are some things that you should expect from the your healthcare provider. So you want a caring demeanor, they're an active listener, they ask questions to understand your concerns and help them elicit information to understand your symptoms. They're open to questions, receptive, and they're friendly and helpful staff. Your responsibilities as a patient in the relationship are to be informed and prepared. You can bring somebody with you, friend, family member, to listen and provide input. Keep an open mind to new treatment. It's okay to ask questions. Remember, as a patient, you have a right to ask questions. Follow through on requests for labs, appointments with other providers, and follow up. Be kind and respectful to staff. All right, what if you want to change in direction? It's okay to change healthcare providers. If your RLS is no longer well managed and you're at the end of the rope, it's time to it's time to change or seek a specialist. So you want to look for an HCP with RLS expertise in your local area, or travel to a quality care center so that you can get your RLS under control. RLS is manageable. I'm going to say that one more time. RLS is manageable. It just takes a knowledgeable healthcare provider with experience to get you back to living the life you deserve. Get the care and treatment that you deserve. And these are some great words of wisdom from the late great Maya Angelou. I learned a long time ago, the wisest thing I can do is to be on my own side and be an advocate for myself and others like me. All right, well, thank you. And I'm ready to start the Q&A.
Thank you so much, Karla, for your very informative presentation. We will jump into some questions, and we're going to start with one that talks about the pharmacy. So what happens if the pharmacist refuses to fill my prescription? How do we emphasize timely refills of medications?
This is a pretty involved answer, so bear with me. We receive a lot of calls, emails, and DMs to the foundation about pharmacists who are unwilling to fill prescriptions. And there are several reasons why this can occur. Is your prescription current? Are you up to date with your office visits to your provider? Are you in compliance with your opioid agreement? For example, did you cancel an appointment or forget to complete your urine drug screen? In addition, and in some states, pharmacists want to see the date of your last office visit with the physician and your ICD-10 diagnostic code, which of course is G25. The second thing is, are you taking your prescription to a new pharmacy or a pharmacy out of state for individuals who spend the winter in the South? So that's something you have to plan out. The pharmacist does not, or third, the pharmacist doesn't know that opioids are a treatment for refractory RLS and will not fill the prescription. The solution is to provide a copy of the 2021 updated treatment guidelines and the 2018 appropriate use of opioids article to treat RLS. So this is your bonus slide, and pull out your cameras, and I'll pause for a minute. Take a picture of this, because here's a third article that you need to have. So you need the treatment guidelines, RLS and iron if you have an iron issue, and the opioids and RLS paper. And then fourth, you're going to have the prescribing primary care provider may need to call the pharmacist and explain the that this is an appropriate therapy and clarify any questions for them. And oftentimes they will provide the pharmacist with this article, or you may need to provide the pharmacist with the article. I would always have a copy of this with me in case you need it and you have a question. And then I wanted to talk about, since we're heading towards the fall and into the winter months, a lot of people travel to southern states in the US to winter. So what you're gonna, if you are on opioid therapy and you plan to travel from the US or to another country, you're going to need to check the policies of both countries before travel commences to learn the required terms and conditions for travel with a controlled substance, because there would be nothing worse than getting caught at the border and not having access to your treatment. So you want to make sure you've done all, dotted your I's and crossed your T's before you hop on a plane or get in the car or get in the train or whatever how you're going to get there. You've got to figure out all of these steps. All right, Adriana, I can go on to the next one.
All right, great question, great answer. All right, so how can I diplomatically forward RLS material to my doctor? I'm getting desperate as the medications do not work as well now.
Good question. We touched upon this in the webinar, but let's do a quick review. In general, you'll want to prepare a packet of information that you'll want to share with your physician. Second, you want to learn all that you can about RLS so you can educate your doctor about what you want them to know. And finally, have a discussion at your office visit outlining your concerns and presenting your packet of materials for them to read when you have a moment. And I can't stress this enough. Whenever you experience a change in your RLS symptoms, you need to follow up with your HCP to determine if there's another underlying cause that may be triggering RLS symptoms. Common triggers may include low iron levels, and which it could be an undiagnosed gastrointestinal bleed, a polyp, or an ulcer. That has happened. Sedentary lifestyle due to a recent surgery or job change that requires more sitting. Another trigger is medication changes, and especially during cold and flu season, a lot of people take OTC meds. You got to be very careful about what you take. So you'll want to check the foundation's medical alert card for medications to avoid and acceptable alternatives.
What if the doctor does not want to be educated by a patient?
As we discussed, education is a continuous process with your provider. Give it a try. But if you feel it's not working and your RLS is not well managed, it might be time to look at other options. Remember, it's okay to change HCPs. I've had countless conversations with RLS Foundation members and non-members desperately seeking care with a knowledgeable and experienced provider. One visit to a certified RLS provider at a quality care center changed their life. Every one of them has gotten back to me and said, I wish I didn't wait so long to do this. On the other hand, it's not just you. So I want you to realize it's equally important to remember that each healthcare provider specializes in certain areas of interest, and RLS might not be one of theirs. So look for HCPs in sleep medicine, neurology, movement disorders, or even pulmonology, because our fan favorite, Dr. Buckfuhrer, is actually boarded in pulmonology. So you've got to just, reach out to the foundation. We've got a healthcare provider directory. We have the quality care center network. So there are a number of options. You may have to move to see drive, move, go on a plane, something to see your provider, but it is doable.
How do you convince your primary care doctor that you may want an iron infusion, even if you aren't anemic?
So my question is, do you need an iron infusion, first of all? But here's what's going on. Every patient needs to know their iron status to determine if they have iron deficiency anemia. Annually, you should have an iron panel plus a ferritin level performed. So on the lab requisition, those are going to be two separate boxes that should be checked. We want to know your ferritin level because that tells us about storage. So that's what's that's what we're looking for with iron deficiency anemia. The 2018 iron treatment of RLS published in Sleep Medicine, which is showing on the screen, in the 2021 Consensus Treatment Guidelines, published in Mayo Clinic Proceedings, are 2 open access journal articles that you should give to your HCP. Why is this important? It provides them with a peer-reviewed journal article that has a medical decision tree with explanations on how to navigate iron management in the patient. So what does that medical decision tree looks like? It looks like a bunch of boxes, and there are lines between the boxes. What side of the tree you fall on depends on your iron status and how your RLS is going. So they could follow that. It's a quick 1-pager. And then also another quick 1-pager is the handout for understanding the relationship between iron and RLS. They can scan through it quickly. It also has citations, and doctors like to have, they take materials that are cited much more seriously than non-cited materials.
Is there one question that an RLS patient can ask a candidate physician to determine if they have adequate RLS knowledge?
That's a great question. Remember to do your research first to identify an RLS provider and to educate yourself too, as discussed in the presentation. Next, I would ask 2 questions, not one. First, how many RLS patients do you manage in your practice? And second, how do you manage refractory RLS? Remember, this is not a one-size-fits-all approach and should be focusing on management of your specific RLS symptoms. Next, I would define refractory RLS as this might be a new term to them. RLS that is not responsive to first-line therapies due to inadequate efficacy, augmentation, or adverse effects. And then again, 2 great options to share with your doctor would be the 2021 treatment guidelines and the 2018 appropriate use of opioid article. And then I would also give them the foundation augmentation handout, the quick 1-pager. And then again, I'm going to thank the foundation members and our scientific member advisory board, because they authored these publications, and they were made available open access because of the generosity of our foundation members. You know, to make an article open access, you have to pay a fee. And so we were able to do that so that all of us can access these articles. And so do know that your membership makes a difference.
What is the best summary of RLS research studies to recommend to my general practitioners?
I would go with this 2021 treatment guidelines. That's what they're interested in seeing, because they will see not only they get the decision trees, how to diagnose, treat, and manage RLS, but they can look at all the citations, and they can drill down to what specific ones they want to see. And at some institutions, they can access those articles for free. Because they have a relationship with Elsevier or Wolters Kluwer. And so those are, that's what I would recommend, because then they can start going through, check this, they could see where that piece of information is coming to, go back to the original source and look at it. So that would be my best recommendation.
How do you keep from getting dismissed by your doctor and friends when you suffer from RLS?
I'm sorry to hear that you've been made to feel this way. I get it. It's happened to my daughter too. And I'm going to share a little story with you about Milkgate. In middle school, my daughter was harassed at lunch by her peers for not drinking milk. We were trying to work in an additional dose of iron at lunch, so milk was not an option. Not only was she harassed, but I also received calls from mothers of students who ate lunch with her. So I took that as an opportunity to educate them about RLS and the iron connection. And instead of getting mad and upset, I said, we're going to go the education route. So more often than not, I believe an individual is uncomfortable or not knowledgeable at RLS. So, and just doesn't know how to respond. So you might want to ask them what they know about RLS and use that as a starting point. Like you, I deal with this in my life. and it serves as a reminder that our work continues as a community to educate others about the disease. Look for a support group network. We have support groups, virtual support groups, and a list of doctors that want to treat RLS. I even drove to San Antonio to attend a support group meeting. It was the best thing I ever did. I was new in the RLS game, and I was just a teary-eyed mom, but those women and men in that group, they picked me up and helped, get me to keep on going with this, because this was not an easy ride with a kid. Most people told me kids don't get RLS, but my daughter did. So you may need to change doctors. I will share with you that we saw several doctors until we found the right doctor for her. So, if it doesn't feel right, it's not right. Trust your gut.
Thank you for sharing that, Karla. How do you educate a doctor who doesn't want to learn new approaches?
It sounds like you might want to find a new HCP to care for you. If you've tried to educate your HCP and they're not receptive, recognize that RLS may not be in their wheelhouse of treatment interests. So it's time to find an HCP who likes to manage RLS. Again, if you need help, call the foundation. You can look on our website. We have a healthcare provider directory. We have a list of our quality care centers. There are doctors that love to treat RLS patients. I can say this from knowing all the doctors on our scientific and medical advisory board. They tell us you are the most rewarding patients to treat. You're a challenge when you get there, but once they get your RLS treatment down, it's so rewarding to see you living your best life.
How can you present yourself as a credible source of information to your primary care physician?
I would say become knowledgeable about RLS yourself and provide them with information regarding management of the disease, such as journal articles and foundation information. I don't know if you, for those of you who are members, we even have a member in upstate New York named Barb who buys all of her HCPs a foundation membership. But part of her RLS advocacy is that she goes out and sees doctors, and if they don't know about RLS, she sends them a free complimentary membership and telling them why they received this. So there are different ways to skin that cat, but I think that that's an approach you may want to consider.
What ways do you offer to share information about RLS with your healthcare provider without being offensive?
First of all, you want to be respectful to them and to their education, their staff, and their time. It's most important to remember, as the patient, you have a right to ask questions and to have them answered. The patient-doctor relationship is bi-directional, and if you don't feel like it's going that way, you might want to consider, seeing someone else. I know I've been in your shoes, and I've had to make this tough decision, and there are times I was in the parking garage crying because I couldn't understand why I can't get through this doctor. What is going on here? And then I just realized it's not in their wheelhouse. It's not you. It's not your kid. You just haven't gotten to the right doctor. And that's okay. We can help you find someone. So, just contact the foundation and we'll see if we can help find you someone in your area or direct you to someone within range or to a quality care center if it's something that you want to consider.
Does RLS need to be managed by a specialist, or can a primary care provider manage stable RLS?
Yes, if they are knowledgeable and up to date with the 2021 guidelines, or if RLS curbside, that would be another great option. So if you feel like you're in a good place, but you want them to know that they have a backup resource, you have the physician education webinar series they can watch on their own, or they could do RLS curbside. And so that would allow them to speak directly to an RLS expert at one of our quality care centers. promise you, as soon as it comes live, we will get you that information. But that way, as long as you're willing to partner with this doctor through their learning curve, that's an option. So you're going to realize you might not be batting 1,000, but you might be batting 500. But you've got to realize you're on a learning curve, and you'll continue to work together till you get the right treatment plan for you.
No one in my area specializes in RLS. Would my primary care physician be the best person to share this information with?
Yes, I would start with my primary care physician. But if your RLS is not well managed, you may need to consider options. So as an educated consumer, you want to learn all that you can about RLS and not to rely solely on your HCP for information. Sometimes you may need to consider seeing an expert outside your geographic region to get the care you need, or you're going to look at referring them to the physician webinar series or to RLS curbside when it's available. So that way they can learn on their own or connect directly with an RLS expert.
What is the best way to ask about or to introduce opioid treatment?
Thank you for this question. It's a very important topic that is relevant to the RLS community. The opioid epidemic is real, and doctors are under pressure to appropriately prescribe opioids. This is a discussion that you should only have with your healthcare provider. They will conduct a thorough exam and determine if this is the best course of treatment for you. It is never acceptable to call the office and ask staff if the HCP prescribes opiates. You're going to get labeled as a drug seeker. So you want to be careful not to only have this conversation with the provider. They're the only one that can make this decision. And it's this is a very, this comes after trial and error of many things. And this is a very delicate conversation to have with your healthcare provider.
Do you have any advice on how to educate neurologists that finding a fix for RLS may not be permanent and they can't just prescribe, refill, and then walk away?
Right. There's currently no lifelong therapy for RLS. Everyone's RLS is different and it changes as we age. So throughout the decades of life, you're probably going to have changed your treatment plan multiple times. Most importantly, if you feel that your needs are not being addressed, you may want to consider finding a new provider, because walking away and not acknowledging you, you have to decide, is that a behavior that you find acceptable or not? So it's really, if it's not, then you may want to consider finding a new provider.
I am gun shy when I tell various specialists that I use methadone. Do you think that I should disclose this?
It's always important to be open and honest with all healthcare providers regarding your full medical and prescription history. HCPs and pharmacists have access to your medical records and will find out this information. So it's far better for you to tell them than for them to come back to you and say, hey, did you forget to tell me you're on methadone? Did you have, and they won't know why you're taking it. So it's just better to be honest that this is a therapy for RLS. Show them the articles. You've got three on, you've got treatment guidelines, opioids, and RLS. So that way you can show them that this is an appropriate therapy for refractory RLS.
How do you approach RLS quality care centers when there are no experienced neurologists in your area?
First thing I would do is to check with your insurance to see if you need a referral. Some policies require it, some policies don't. And then other places, and then the other thing, some institutions such as the Mayo Clinic require a referral. So you get the referral, then it goes to a committee and they'll decide if they will accept you as a patient. So the other thing is, so say you're going to another quality care center outside of Mayo, you have to decide if you're going to pay out of pocket or out of network fees. So be prepared. It's going to cost a little bit more, but you're batting 1,000. So you'll need to call and make an appointment with one of the physicians listed as a certified RLS provider for that QCC. And all of their names are on our websites under each QCC. And then this is really, really important because this mistake happens a lot. So don't let the scheduler book an appointment with any doctor other than those listed as the certified RLS provider for that quality care center. The scheduler will not know the names of certified RLS providers, so you will need to kindly persist with your request for the provider you want to see. They're going to say, well, it'll take you longer, they're just as good. No, these doctors went through a review by their peers of their credentials and of their patient load to say that they can manage all levels of RLS, including those who have severe cases. So just kindly persist, and I want to see Dr. So-and-so at XYZ QCC.
Get a doctor to understand that after surgery, you need a treatment plan that manages your RLS and postoperative pain without labeling you as an opioid seeker.
Oh, that's important. So as an RLS patient, you need to be knowledgeable about your RLS first and to educate the surgical team at each step of the way through your pre-op visit. And you want to be sure to schedule an appointment with your RLS provider prior to your upcoming surgery and have a plan in place for management of your RLS during your hospital stay. Ask the surgeon to consult your RLS provider, and this is a strategic move on your part to have access to your RLS provider during your hospitalization. So say if they can't get a hold of your surgeon, then the nurse is calling, you're having breakthrough symptoms. So that way they have another doctor they can call, but you're consult on the case for this reason, to have that RLS provider. So please do make that extra office visit. It's worth it. Second, you want to notify the individual who's going to accompany you to the procedure of your treatment plan for RLS and have copies of all materials distributed to the surgical team. We have several materials that you can share with the surgical team. I call them partner materials in the office because you need a complete pack. It makes the most sense. So you're going to need a medical alert card, a causes, diagnosis, and treatment brochure, surgery for the RLS patient handout, a hospitalization checklist, a medical bulletin, a copy of the peer-reviewed articles that are up on the screen, and share this information. Will alert the team to your RLS status, medications to avoid, acceptable substitutes, and how they can best manage you when you are in surgery, in the pre-op area, in the post-op area, and when you're back on the floor. Other things, if you need assistance, call the foundation. Our staff we're all qualified to help you get the material you need and to whomever you need. If you are having an emergency appendectomy, call us and have a nurse talk to one of us. We'll email the information to them. This happens quite frequently. And so we're able to help people get the information they need so they can get the care that they deserve.
Other than neurologists, why is the medical community so unaware of the debilitating effects of RLS?
This is a shocker, but in general, medical school curriculum allots only 15 minutes to coverage of sleep disorders. So they don't get much about RLS, narcolepsy, even sleep apnea, the big three. So this is something I spoke to the national academies last year about, is including the study of sleep disorders in the medical curriculum. And they're like, well, what do you want us to take out? I said, that's something for you to figure out. But when 10% of the population has restless leg, then we need to be addressing this. This is 1 in 10. We can do better as a society so that people can get the treatment that they deserve and not have to wait 13 years to commence treatment.
Last question here. Is there a way to test for RLS at home without doing a sleep study in a lab?
We get this question a lot. There's no specific test for diagnosis of RLS. It is based on patient interviews, so it's subjective symptoms. So what are the criteria? These are the RLS criteria. The doctor's going to ask you about these in many ways. So is there an urge to move? It's rest induced. So it's when you're sitting down or lying down at night. It gets better with activity. It's evening or nighttime worsening. So around 6 o'clock at night, when you're starting to wind down, eat dinner, moving into getting ready for bed, going to bed, that's when RLS comes out to play and stays up through the wee hours in the morning, and then kind of like starts waning off between like 4 or 6 a.m. So that's that evening and night worsening. And it's not caused by another medical or behavioral condition. So they're looking for other secondary causes that might be contributing to an RLS type situation. And also, anyone screening someone for RLS should also check their blood work. We want to do not only a CBC, but we also want to check that ferritin level. That's another iron panel, check. CBC, check. We want to check ferritin level, check. So we got 3 check box going, plus anything else. What if you have a thyroid history? Do you have a blood lipid issues, things like that. So you're going to look at a number of things to make sure that there aren't any mimics in there. So we're going to look for additional studies and a sleep test to rule out any other underlying condition. So an RLS is not diagnostic, but if you have enough PLMs per hour, then that'll say that there's a good chance, that you're probably somebody who may be having RLS. So they'll continue to kind of just weed it out. It's not the sole character, so it's not a diagnostic test for RLS, but it would help support it, is what I'm saying.
All right, well, thank you so much, Karla, for sharing your presentation, and thank you for tuning in to today's webinar. We are hosting yet another RLS Patient Symposium on October 21st through the 22nd at the beautiful Maritime Conference Center in Baltimore, Maryland. To learn more about this exciting event, visit www.rls.org and register today. Thank you again, and enjoy the rest of your afternoon.